Now, recently I got the chance to sit down with Ambassador Birx, and here's the first part of that interview. You currently serve as the White House Coronavirus Response Coordinator, but you've been a fixture at international AIDS conferences through your role as U.S. Global AIDS Coordinator, overseeing the implementation of the U.S. President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, and you're here to speak about global commitments. Ambassador Birx, thanks for being with us.
Thank you. I just wanted to start in the mass just to alert everyone at the International AIDS Society virtually that masks around the world will really help protect us, both ourselves and spreading COVID to others. So thank you, and I'll take it off to speak to you now since I'm here with just the computer.
I've got my mask right here, Ambassador Birx. Thank you so much for being here. Now, where are we in achieving global HIV commitments, and what's it going to take to help get that over the finish line?
You know, we were so pleased with the Global Fund replenishment, and I just want to congratulate Peter Sands. I want to congratulate our Congress, who really increased the United States commitment. I think to be able to achieve that right before this intersection of the three epidemics of HIV, TB, and malaria with COVID-19, I'm just really grateful to the international community who increased their commitment. So that's the financial side. Obviously, there's a lot of work we still need to do at the level of community to demonstrate that level of commitment and translate that commitment into real actions that honor and support the communities that we serve.
So how has the groundwork laid by PEPFAR prepared us for the COVID-19 response?
Now, that's a great question. PEPFAR has worked really hard over the last 17 years to really build health infrastructures in resource-limited settings. So we've not only increased human capacity from the health center all the way up to regional referral hospitals, both nurses and doctors, and really critically community health workers throughout sub-Saharan Africa and other places that we've worked. But I think what really has become key within COVID-19 around the world, including the United States, is our work to build these RNA viral load platforms, from the Roche to the Abbott to the Cepheid, to the Panther Hologic, to the BD. All of these were critical for our HIV response for viral load. And it's those very platforms and the laboratory technicians that know how to run them that are providing these COVID-19 tests around the world. Now imagine if we hadn't made that investment in these platforms. Imagine if we hadn't had these diagnostics companies improving and building those platforms, if we hadn't had the trained laboratory technicians in sub-Saharan Africa. We would be nowhere right now. And so I really want to applaud, not only the work PEPFAR has done, but the work that ministries have done to really increase their laboratory capacity, because that is serving us as best we can right now to combat HIV, but also COVID-19.
It's phenomenal. So what can we learn from PEPFAR about strengthening global cooperation?
It was the relationships that I had with ministries of health around the globe that early on, when the virus entered Europe and they were really under a very difficult time, in their moment of crisis, they answered my phone calls and they talked to me about what was happening in their hospitals. It was that information from the front lines that allowed us to translate that information to our front lines and really saved many lives. So that level of those relationships that had been built over the years were really critical in our initial response. They informed us, they helped us, and it really had solidarity there. And that same level of solidarity you can see in Nigeria, you can see it in South Africa as they combat COVID-19, of that really open and transparent sharing of data and information in real time. And I think PEPFAR is really known for being data heavy and using data for action. And I think that level of cooperation and use of data really put us in a place where we could use information in real time to combat this pandemic.
So what would you say then that the challenges are that lay ahead for PEPFAR in this whole new era of COVID-19?
So we have deep concerns. We worked really hard with ministries of health and communities to really increase community-led monitoring and funding communities for both ensuring that our programs have high quality in the field and really working with facilities and community outreach groups, and also working both prevention and treatment. And we really were at an inflection point of improving quality. We worked with ministries to also increase what we call multi-month dispensing. At the time, I think to many it was considered theoretic. The countries that had moved on that had given patients 3 and 6 month drug supply, are really in a much better position to really ensure that clients remain on treatment. But none of us, our first 2 quarters went through really before COVID hit a lot of the resource limited settings. This next 2 quarters bring us, we have deep concern. We have deep concern about how our clients' needs are being met. We have deep concern that this may have resulted in increased viral spread as people were unable to get their treatment. And so I think the good news is we have the data and information down to the site level, down to the most granular, where we can see the clients and we can see if our clients have been lost. And so we really think the next 3 months are going to be really critical to analyze the damage that has been done to the HIV, TB, and malaria programs and restore those programs to full health within this new reality of COVID-19.
Ambassador Birx, thank you so much for your time and also for everything you do in the community. I've got my mask. Thank you.
Great to be here. Thank you.
When we come back, we are going to meet a nurse who was there right at the beginning of the AIDS epidemic in San Francisco.